Okay. Started the timer, and here is your question. Right. If you have read and understood, considering a history demonstration, can you begin?
Yes. Good morning. I'm Mr. Ghazir of Surgical Dr. Zair. Can I confirm your name and age, please, sir?
Yes, I am John, 54 years old.
Hi, John. How can I help you today, John, please?
Yes, doctor has difficulty swallowing.
Yeah, so I'm really sorry for that. It must be stressful for you. But if you don't mind, John, can I ask you some question regarding your issue besides taking notes? And
Yes.
it's gonna be confidential. Don't worry, okay? So when did it start? Firstly, this difficulty of swallowing.
Yes, it started 10 months ago.
10 months ago.
Yes.
Yeah. So did it start suddenly or gradually?
Yes, gradually.
Gradually. Since have you experienced it increase or decrease or constant?
Yes, increase.
Increase. So is it specific to solid food or fluid or all?
It started for solid foods and now for even both solid and liquids.
Yeah. So did it affect your daily life?
Yes, for sure. I can't swallow well, so thus affect my daily life badly.
Yeah. I'm sorry for that. So have you noticed something increasing it?
No,
Have you noticed that anything making it less or better?
no, I did not see that.
So have you noticed any change in your weight, please?
Yes, doctor.
Can you tell me more? How much have
I
you
have
lost?
I have lost about 10 kilo in the last 2 months.
Yeah, I'm sorry for that. So is it intentional or not?
Yes, intentional.
You you you
Not
you you,
intentional.
No,
you are
non-intentional. Sorry,
Mm.
yes.
non-intentional.
So
Yes.
so what about your appetite?
Yes, I have lost appetite. Yes.
Yeah, for all food or a specific one?
Um, Not for oat food, but because I can't swallow well, so I lose appetite of most of foods.
Yeah. Okay. So have you noticed any lumps or bumps in your neck?
No,
Okay. Any heartburn?
no,
Any vomiting?
no,
So have you noticed any change? Have you any change in your neck in form of gurgling or moist voice?
no,
So what about any numbness or weakness in your arms and your legs?
no.
So did you bring any blood from your mouth?
No.
So I will ask you about what's your occupation, please?
Yes, I am working as a constructor
Constructor. So with whom you are living at your home?
with my wife and children.
Okay. Do you smoke?
Yes,
How many packs per day, please?
around 2 packets per day.
2 packs per day. So do you drink?
Yes, I drink about 6 units per week.
Yeah. Okay. So, do you have any family history? Anyone in your family has had like this before?
I can't remember, but maybe my grandfather complained with this, but I can't remember well.
Yeah. So, do you have any medical conditions?
No,
Okay. Do you receive any regular medication?
no,
So, have you had any surgery before?
no.
So, what do you expect is the cause of this issue?
Maybe cancer?
It's little bit early to say that. You may need to arrange some investigation to figure out your case. Okay. So what do you hope us to do for you?
Yes, I want to eat all the food normally.
Yeah, hope this. So just one question. Have you noted that? Do you have any change in the temperature of your hands or legs, please?
No,
So any change in your eyes, please?
no,
Any blurring of vision?
no.
So some rapid review of your other system, please, to avoid miss anything. Do you have any headache?
Headache?
Yeah.
No,
Any backache?
no,
Any chest pain?
no,
Any bone ache or muscle ache, please?
no.
So thank you for your time,
Bowel
Mr.
habits.
John. Thank what?
Bowel
What, ma'am?
habits. Bowel habits. Ask.
Any change in your bowel habits?
No,
Okay.
Noticed
So
any blood in your
water
stool?
work,
Yes.
any water works issue?
no,
So any blood in your stool, please?
no.
So do you have any notes to be added before finishing our conversation?
No, thank you, doctor.
So thank you for your time. I
Okay,
will pass
yes,
my notes to
present
my
your
consultant to figure out your issue. So today I took a history from Mr. John, 54 years old, who
Good.
presented with difficulty of swallowing with gradual onset, progressive course 10th months ago. It started to the solid food and now for solid and fluid. He had a significant history of unintentional weight loss, about 10 kilogram over the last 2 months, with decrease in the appetite. he he had a family history, but he didn't remember well of grandfather's sinister. He is
Yes.
his smoker and alcohol drinker. So no other symptoms suggestive of other disease. So my top differential diagnosis is esophageal carcinoma or cancer esophagus,
Yes.
but I will consider other causes of dysphagia in form of chronic heartburn, bulbar palsy, myasthenia gravis, any outer swelling, compressing the esophagus, and also achalasia of the cardia.
Yes.
So
How would you
um,
confirm your diagnosis? What investigations would you
I
ask
will,
for?
yes, I will start initially by full clinical examination and
Good.
search for any lymph nodes, and then we'll order some investigation in form of the lab. But the most important to do upper GI endoscopy with or without biopsy, barium swallow, endoluminal ultrasound with possible of biopsy, video fluoroscopy,
Yes.
and also for evaluation of
Okay.
the lesion, CT with oral and IV contrast,
Yes.
and if the patient is cancer, metastatic workup is
Good.
obligatory.
Can you
Yes.
tell me what treatment options can you offer to this patient?
Yes, according to the patient, will
Yes.
discuss in MDT team.
Very
If the
good.
patient is operable or non-operable, if the
Very
patient
good.
is operable, we will do radical oesophagotomy with the modified with nuclear dissection. If inoperable, we'll put a stent, chemoradiotherapy as adjuvant, painkiller, and feeding jejunostomy.
Very good. Excellent. Complete. Good.
Thank you. Thank you.
Good. Yes. Started your timer, and here is your question.
From my side, I am ready.
Yes, please. Yes. So if you've read and understood, considering it history taking
Okay,
station,
good afternoon. I am Dr. Muhammad, the treating doctor today. May I confirm name and age, please?
Yeah, Mr. Muhammad, 77-year-old.
Nice to meet you, Mr. Muhammad. Today I've been asked to take a history from you. So how can I help you today?
Yeah, actually, doctor, 6 months ago, I experienced the difficulty in urination, and I am here today to fix this issue, please.
I'm so sorry for that. Must be very stressful to you. But let me ask you first some question to establish a diagnosis, okay?
Yeah, welcome.
Started 6 months ago, right? Can you tell me it started suddenly or gradually?
Yeah, it started gradually, but just difficulty in urination. After that, I noted that I have a poor stream. Till I noted that I just go to the toilet to only to with dribbling of my urination.
Yes. And you know that this difficulty increasing or decreasing or the same or
Yeah,
stationary? Increasing.
increasing since I have experienced. Yes,
Yes.
increasing.
And do you notice that anything that increase this problem?
So I noticed I had like nasal allergy since 1 month. So the progression of this issue increased. So for about nasal drops, I took prescribed from my doctor. I
Mhm.
noted that the issue increased with this.
Yes, and I'm sorry for the problem. There is no problem. We will handle everything. Just a mistake from me. And so, what about your weight? Do you have that? You have lost any weight?
No,
Okay. Do you have unintentional loss of appetite?
no. As seen before.
Okay. Do you notice that you are up in the night to go to the bathroom?
Yeah, I noted that I have a increased frequency
Okay. Do you
of
notice
the
that?
urination. Yeah,
Yes. Do you notice that you are hesitant on going to the bathroom?
yeah, yes. I noted this, especially the last 2 months.
Okay. Do you have the feeling of passing urine despite passing a minimal amount?
Yes.
Okay. And you said that you have a dribbling knowledge. Do you notice also that your urine passage is intermittent?
Yeah, and weak also.
Okay, and weak. Okay. Do you have any history of trauma, especially to the back or pelvic?
No.
Okay. Do you have any back pain?
No.
Okay. Do you have any weakness in your upper limb, hands or legs or feet or foot?
No significant. And it just after manual working, but not meeting with this issue now.
Okay. Do you have any diminished sensation on your legs?
No.
Okay. So what about your medication? Do you take anything rather than the alpha agonist for your nasal spray?
No, I just take for hypertension just one tablet. I don't know the name. Before breakfast.
And it's controlled?
Yes.
Okay. What about your surgery? Have you done any surgery before?
No.
Okay. Do you have any drug allergy?
No, just skin allergy to the cotton.
Okay. And is there one if your family has the same problem before?
No, I didn't remember this, but it's not mentioned in front of you from other family members.
Okay. And what about your work, Mr. Muhammad?
Yeah, I'm a teacher.
Okay. Do you live near any dye company or other?
No.
Okay. With whom you are living?
Yeah, with my wife.
Okay. Do you have a problem with upstairs?
I am in the first floor.
Okay. And do you smoke?
Yeah,
How many packets a day or cigarettes?
just 1 or 2 cigarettes per day only.
Okay. And do you drink alcohol?
No.
Okay. So what do you think maybe the main cause of your symptoms?
I'm not sure, but this is alarming for me, agonizing for me. I hope that is not sinister.
It's not a what?
I hope it will be not dangerous disease.
No, it will not be. For sure, we will do our best to alleviate your symptoms. And what do you think? What are you more concerning about regarding your symptoms?
Yeah, the poor stream of my urination.
Okay. So, Mr. Muhammad, do you have any chest pain or cough?
No,
Do you have any back pain? Do you have any joint pain or muscle pain?
no,
Do you have any change in your bowel habits?
no.
Okay. Do you have any blood in your urine?
Yeah, at the course of the complaint, I noticed once or two times, like red urine. After that, didn't notice it.
Okay.
Okay, can you
And
present your history now?
yes, today have take a history from Mr. Muhammad, 77 years old,
Okay.
complaining of complaining of urine retention, which started 6 months ago. It's gradual onset. He has symptoms of benign. He have symptoms of intermittent ball streams, dribbling, nocturia, hystency, which and he has no any symptoms or signs of suggestive of trauma or cancer. So my main differential diagnosis is benign prostatic hyperplasia. I should also consider other causes such as overactive bladder, pelvic tumor.
How do you plan to confirm your diagnosis?
To confirm my diagnosis, I will do first
Full clinical examination.
yes, full
including
clinical
DRE, then
yes, full clinical examination and full clinical and abdominal examination, and then imaging of CT abdomen. Sorry, I will do
you'll do
Uh,
blood, PSA, urine
yes,
analysis,
blood
and
for
then
yes, blood for
abdomen.
BSA.
Okay.
and
What
CA.
management can you offer to this patient? There is
Uh,
some effective. Yes.
I will ask the patients if he have done any caster before, and first emergency action start doing caster or suprapubic caster, then looking after then giving the patient treatment for PPH like
For example,
like
yes.
yes, like finasteride and alpha reductase inhibitor, and that's all.
Yeah.
Finasteride.
Okay. If medical treatment fails, then you ask for surgical.
Therapy, transverse
Yeah,
resection of data.
Okay, started and here is a Dr. Hamdi is going through the notes. All right, so if you have read and understood, considering this communication skills session, kindly begin.
Yeah. Hi, Ms. Jane. I'm Mr. Ghaziri, one of surgical SHO here. So I'm sorry that you haven't contact before, but just I want to ask you first, what do you know so far about what happened for your child, please?
I don't know anything. I just know that he felt and came to the hospital. What's happened to my child?
Yeah, so I do appreciate your concern, but firstly, can you take a seat, please, and be calm? And I will tell you about everything about your child condition. Miss Jane, unfortunately, that your child came to A&E department. After that, before that, he apparently climbing off her climbing frame and injured himself. When he came to A&E department, he was scanned, and the scan of of his tummy was done, and revealed that he has suspicion of rupture of spleen. Spleen is an organ that is present in the upper part of his tummy at the left side, maybe due to crack in the nearby ribs. So I'm really sorry that we couldn't see him before he was taken to the OR, as he is now being to be operated to fix this issue. So how does that sound, Miss Jane?
Really? You say that he is in the operating room. How does that happen? I don't know all of this. Is this dangerous?
Yeah, so I appreciate your concern, Ms. Jane. Please, you can text it now again. Be calm. To be honestly, that your child is injured and falling from the climbing frame, as I mentioned to you. Ruptured spleen is a serious condition, unfortunately to say that, to the extent may lead to a danger to his life. But what I can say to you that he is now being to be operated in a good, well-experienced, well-trained hands, but also his condition is serious to the extent may danger to his life. I'm really sorry for that, but I must be honest with you in demonstration of your child condition. So is that clear?
Okay. And what his father told you when he came?
Yeah, sure that his father say that the child was playing at the garden, and when he called out in pain and suspiciously injured himself, and when he saw, he noted that a bruise in the lower part of his chest. After that, he called the ambulance and brought the child to A&E department of our hospital. He says that. Is that clear for you?
I think he is lying. His father is drinking a lot. He is drunk and he is careless. And he previously my child. He was previously my child has a cut wound with him, and he can't take care of him.
So I'm really sorry for that, Ms. Jane, but in this situation, I have to mention this information, and we will need to arrange extra precautions and procedure to make sure that everything at the home is safe for your child. So, as regard your notification, I will involve a child protection service, including child protection consultant, to make sure that everything will be done at your child's best interest. How does that sound, Ms. Jane?
Okay. And can you tell me what is the function of what's called this spleen, which got injured? How will this affect his life?
Yeah, actually, the spleen has a body defense mechanism. So if his spleen is going to be removed, he will need to be vaccinated against potentially infection he may get, and also may include microbiology team and our MDT team, including pediatrician, to he may receive a lifelong prophylactic antibiotic to prevent any infection he may get. How does that sound, Mijay?
Okay. Okay. Please. So what are they doing now? Can you enter and tell me what is going in?
To be honest, I can't enter the OR now to avoid interruption the surgery team. But I promise you that once your child came to the recovery room, I will call you, or a nurse will call you to update you about his conditions. So is it okay for you?
Okay, so how long he will be stay in the hospital?
So as regard this time, I can't give you an exact date, but to make sure that your child health is our priority, so we will not discharge him until we do serial abdominal examination, general examination, and make sure that his GB is alert to any concern, any alarming sign may affect your child. So is that okay for you?
Okay, thanks.
So do you have any concern or any issue? Any other
No.
question?
No, thank you.
So just to inform you that we are here beside you, and your child care is our priority. And if you have any other question, you can ask a nurse to contact me or the other SHO in charge. Okay, thank you. I-
Ask about the if consultant is expert in the surgery.
Yes, okay. And do you think that the consultant is expert in this surgery?
Yes, as regards this question, all our consultant here are well experienced and well trained, and did many surgeries like this before, and they are eligible for this, and they can manage any adverse outcome and complication may appear during the surgery. So, is it comfortable for you, or do
Tell
you need
about
to
the
ask about any
vaccination
question?
and antibiotics.
Yeah,
Like-
I told
Okay,
ma'am.
okay, all
I
right.
told.
I missed.
Yeah.
I'm sorry.
Yeah, no problem.
I think there is someone tell that in this scenario or another one, she will ask him about the name of the consultant, and she will tell him that yes, I know this consultant. He has done an operation for my uncle before, and he
That's
is
for
good.
appendicitis.
Yes, for
Right?
appendicitis. Yeah.
Ah, okay.
Here, a problem is with husband.
Yeah.
Okay.
Okay. So at the end, you can say, all right, if there is a question, you can ask the nursing staff and you can contact me through that. So less 20 minutes are left. So 20 seconds, sorry. Okay, bell will go soon. Right. Yes, it was mostly covered. Now bell went. Right,
Yeah.
good. Thank you. The one little thing, in this scenario, here, if you read Dr. Muhammad,
Yeah.
patient's mother is there and she is making noise that where is the doctor, where is my child, and who is taking care of him and everything. And you will come and you will say, okay, may I know what is your relationship to the child? Okay, child can be XYZ, anything. And then she will say, I'm the biological mother. And then you will say, okay, I am the doctor in charge, or doctor whoever.
Yeah.
And then how can I help you? And then you can ask her. And then that's how it should begin.
Yeah.
And
So
like you said in later on, that please have a seat, and you try to calm her down. That will be in second stage.
yeah, I
Yeah.
said that at the beginning of the station.
Yeah.
Yes, I am Miss Jane. I am Mr. Kaza. Firstly, I will told you about anything about your child condition, but firstly, you can take a seat, be calm. Can you can you tell me what do you know so far about what happened for your child? This is the entry of the station.
But
Yeah.
here you will confirm the relationship first, because here she is demanding to meet the doctor in charge.
The
So
first
you
I
will
will ask about the
confirm,
relationship.
what is your relationship to the child, X? And then she will say, I'm the mother. Okay, then you'll say, okay, I'm the doctor in charge.
Yeah.
How can I help you? So begin like this. And the rest, it was good. At one time you said patient has been taken to OT or OR, you said, but like here mother is not a doctor, so she would not understand what OR is. So better to use layman term. All the rest was okay. It was good.
Yeah. Yes, thank
Good.
you.
Thank you so much.
Thank you very much. Thank you. Thank you. I'm ready from my side.
Good. And here is your question. This is breaking the bad news station. Okay. Right. So if you have read and understood, considering it communication skills station, kindly begin.
Okay. Sorry, here I am the GB.
Yes, you're the doctor.
Yes.
You are ST, SHO or surgeon, because
Yes.
GP has sent this patient to you.
Okay. Okay. Okay.
So you are surgeon.
Yes, okay. Hello, I am Dr. Muhammad, one of the surgical house of one of the surgical candidates. I'm here to you to discuss to discuss you about your results. What do you what do you
Good. How much you know about it? Good.
yes, how much you know about it?
Very good.
Yes. Hi, Mr. Muhammad. So actually, in my notes was mentioned that I underwent removal of my right breast, followed by medical treatment and radiation treatment. On follow-up of my GP, he requests some blood sample for some investigations. So after that, 2 weeks later, the doctor told me that I need to be reviewed by my surgical team in your hospital again for some issues in my lab investigation. So I am here today to be clear about this from your side. And this is a copy of blood investigation in your hand, please. So can you notify me about any issue regarding this investigation, please, Mr. Muhammad?
Yes, firstly, I appreciate your concern regarding your
Lab
regarding your
results. Yes.
regarding your worries about about your right mastectomy, about your breast removal history. Let me tell you that these labs are for the following up after taking chemo and radiotherapy, as we have told you before, or it is not told you, that this may be recurrent. For these investigations, there is an increase in some investigations indicating that there may be a lesion in other sites, so we'll need to do an extra investigations, mainly imaging. Are you okay with that?
What do you say, doctor? Investigation for the other side? Is it? It is.
Is it cancer again?
It's. Yeah. It's very. I am very anxious. I'm very terrible about this event. I can't withstand. I will go now outside the hospital. Please don't tell me I have another sinister in the other side. I will not be comfortable with this event. My grandmother died with this issue after taking the other side with sinister.
Please calm down, Miss. I know that this must be very stressful to you, but you know, these labs, as it's high, this doesn't confirm that there is another issues in other parts of the body, but to confirm that we had to do extra investigations to rule out any lesion in other parts, and this is usually done after as a follow-up for the breast cancer. What does that sound?
So you need to ask me about the approval of the request of the other investigation. So you need
Yes.
to do other scan of the other side of my breast, the left side. But
Yes.
you didn't mention that. What is alarming in my investigation? Is there any suspicion to get another sinister in the other side, or it is just suggestive? So it is cancer now. You can tell me now. Is it a cancer?
No, there is some elevated bloods which may denote lesions, but we can't determine what is this lesion in other parts. So we may need to do imaging, most probably CT, to show if there is any other affection in other parts of your body. Is that clear?
This is not clear. I have been told from my surgeon 2 years ago that there is a percentage of relapse either on the other side or other part of my body. So which one is suggestive? May I have a relapse in the other part of the body, not the other side of my breast?
Yes, maybe that, and so we'll do imaging.
So how can I confirm this from the other part of the body, from the other side of my breast?
For that, we will do imaging of the other parts of the breast and also imaging of whole body to get sure that there is no any lesions in other parts of your body. So is that clear?
I have. So now this will take a long time.
Actually, we are trying. We do the investigations for our patients within days, and we will do our best to do that. And I confirm you that we will not make you suffer anymore. And if if the investigation is not available, I will transfer you to another hospital. Is that
So
okay?
excuse me, doctor, just the last question. I have one brother in Australia. So shall I tell him about this sinister now? I don't have anyone look after me. So how can will arrange this lonely? So what do you think about this?
Okay. Firstly, it's your decision to tell him or not. But if he will give you more support and he will take care of you, so I think it's maybe okay.
So thank you, doctor. So can you give me now the exact date for further investigation? I will need to come to run out my investigation in your hospital.
Yes, I will liaise with the imaging team and confirm and take a schedule for that and confirm you, and I will call you once we had an appointment.
Yeah. Thank you, doctor, for your help and your advice. Regards. Thank you.
Is this a new station?
Yes.
No, the new yes, this new
Now
station.
Bell has got. Okay, thank you. Right. How was it, Dr. Hamdi? Was tough.
No, so it's very difficult if you don't know the scenario because
Yeah.
you
Here,
are.
in this scenario, I will just like to remind you one thing you did very well. You started off very well. You asked the patient how much she knows about the reports or her case. Then your second question should have been, because I told you before you started, this is breaking bad news. So
Yes.
when you're breaking a bad news, so you have to
Mm.
make sure patient is comfortable. You ask the patient to sit down comfortably, and then you
Mm.
can ask, do you have any relative outside whom you want to be inside with you, just
Mm.
for comfort? So if she says no, that's all right, I'm alone, no one is with me. Or if he says, I have my child or my husband outside, you can say, okay, if you want, I can ask the person to come inside and just to give you support, so that we can
Okay.
discuss your reports together. So that's how you'll comfort the patient, you'll gain the trust, and then you'll gradually say, and here Dr. Muhammad was doing it very nicely, but here patient will be like in a state of shock, because 2 years ago patient went through chemo and radio, and patient was told, now you're free of cancer. So she was enjoying, she's only 50, she's young, so she was enjoying her life. Okay, I'm cancer free. And all of a sudden she had the problem and GP sent it to you. So there is, and another question,
Okay.
you were continuously saying imaging. What is the layman language for imaging?
Scan.
Scan.
Scans or photo? Yeah, more investigations.
Sorry.
Yeah.
Yeah, so imaging was wrong. You continuously said imaging, but here the other person is doctor, so he understood. If a person is not a doctor, would not understand. Here, even we would have to take your body photographs. We even use this kind of language, like so low
Mm.
and vague we go, and we say, okay, not everyone understands the scans even, so we say whole body photographs we have to take.
Photograph. Okay.
Yeah, or you can say any layman language, more investigations we have to do. So these are the two things that I thought, but otherwise this I'm only telling you so that you can improve. Otherwise it was good, because you did not say to the patient that it's cancer or it's susceptible, but you were continuously trying to convince the patient for more investigation. So yeah, good.
Yeah. And
You
here
know,
it's most probably has a bone mets, right?
yes,
Okay.
gamma glutamate transferase is high, and alkaline phosphatase is high as well. So maybe patient has backache history, that's why I went to GP, and yeah.